is not merely the absence of disease, but a state of well-being in which the mind, body, and spirit are balanced. Hi everyone, my name is Carly Edick, and today I will be discussing why exercise is a better treatment option than medication and prescription pills when dealing with patients who suffer from depression and anxiety. I chose this topic because my mother does suffer from depression and anxiety. She's been dealing with this for most of her life. About 10 years ago, she decided to go to the doctor to get something to help her deal with this depression. They did prescribe her medication, and after a few years, she became very reliant on the medication and was also taking different drugs to help her feel better. Since she had been taking them for so long, they didn't work as good. So she went to other options. She got pills off the street. She also got medication from her friends, sometimes not even knowing what the pill was for. She soon wasn't really able to function in her day-to-day life. She was forced to retire from her job. She also did go to rehab, and she did spend some time in a mental institute. Fortunately, we do have a very strong family support system, and she was able to overcome this addiction, and she is currently in remission. Now, I don't think the doctors prescribed her the wrong medication, but they didn't really give her any other options to deal with her depression and anxiety. They just gave her the medication in hopes that it would go away, but all it did was just really mask those feelings. According to Megan Teaching, in an article titled Association Between Physical Activity and Depressive Symptoms in Women, there are currently 340 million people worldwide that are living with depression and anxiety. Many of these patients are just given pills to treat this. Exercise would be a great way for these patients to help deal and cope with the depression instead of just masking the feelings that the pills take away. Studies show that having a minimum of 60 minutes of physical activity per week will lower your risk of depression. Exercise classes, fitness groups, weightlifting, they're all something that you're going to be around a positive atmosphere. You can also create a lot of social bonds with people through exercise and fitness. By joining these groups, you're around other people who are doing the same things. It's going to boost your energy as well as provide you a positive outlet for your daily stress and life that happens. According to Olga Kazan, from an article titled For Depression Prescribing Exercise Before Medication, they did a study where they took 127 patients where medication was not helping with their depression or anxiety. Of those 127 people, all the 127 people were given an exercise treatment plan. 30% of those patients are actually in remission due to the exercise. When you exercise, you're releasing natural endorphins that are found in your body, and these act as a natural painkiller and a mood supplement. So it's going to increase your mood into a more positive level. Also, when you're working out or exercising, you're going to sweat. This creates an opportunity for your body to release its toxins. According to Miriam Hawkins, in an article titled Are There Alternatives to Drugs?, she explains how, as humans, our bodies are made to move and to exercise. Exercise not only strengthens your mind, but it also helps with muscle tone, it helps develop your lungs, as well as help with your cardiovascular system. Taking medication is very detrimental to your organs as well as your glands. Exercise is also a very cheap way to help deal with depression and anxiety, although a lot of doctors will not prescribe this or even recommend them to their patients. According to Olga Kazan, only about 40% of doctors do offer their patients other treatment options such as exercise to deal with the depression and anxiety. A lot of this has to do with the insurance companies. Many insurance companies are not going to pay for individuals to go to specialists, so people are just seeing their regular primary care physician. Also, doctors don't really have a lot of time, so when they do see the patients, they're not going to spend a lot of time with them. So on average, a doctor will see about 4 patients per hour if they're just dealing with pain medication or just giving them a new prescription. Whereas if they were to do a therapy session, usually they take about an hour, so they would only be able to see 1 patient per hour. By providing the patients with prescription medication, they're also getting insurance money from the insurance companies. A quote from Olga Kelzan was that 62% of all antidepressant prescriptions are now written by general practitioners, OBGYNs, and pediatricians. Also, in 2007, 73% of patients who were prescribed an antidepressant were not given a psychiatric diagnosis. So a lot of these patients are being prescribed something that they may not even need, and it might not even help them. Another issue that is really affecting our society today is addiction. And a lot of this stems from prescription pills being offered as a treatment option. According to an article titled Powerful Tools to Pinpoint and Prevent Prescription Drug Use, the Control for Disease Center stated that in 2014 there were 19,000 deaths that are associated with overdosing on prescription pain medication. Also, the CDC states that there are 78 people per day that are dying from addiction to opioids. Also, President Obama this year did sign an act called the Comprehensive Addiction and Recovery Act of 2016, and this is going to provide a chance for them to limit the amount of prescription pills that are being prescribed to patients, as well as providing drug monitoring programs. And I think this is something that we really do need in our society. A lot of times, you don't even realize that you can become addicted to something that your doctor is prescribing to you, especially because you're relying on their expertise to give you the right care. And I just believe that if more doctors or even individuals were to look at exercise as a different treatment option, that we as a society could function a little bit healthier and hopefully find a way to deal with all of this depression and anxiety that is on these individuals. Also, I think awareness is a big thing that will help this as well. So if you do know anyone suffering from depression or anxiety, or even yourself do, and you feel like your doctor is only prescribing you medication, just know that there are other options out there. Exercise, I think, will be a great way to deal with these issues and hopefully help save a few lives and relationships along the way. Thank you very much.